Welcome to South Charlotte Sports Report Live on a Wednesday afternoon. I am so excited to bring in a guest that can bring so much value to our discussion today. Dr. James Rachal from Atrium Hospital. Can you tell us a little, first off, good afternoon. How are you?
Hey, fine. How are you doing?
Good. Tell us a little bit about what you do for Atrium.
So I'm the medical director for Behavioral Health Charlotte. I'm also the academic chair for the psychiatry department. So I lead the biggest mental health center in the county, and then I also we do right at the Behavioral Health Center. We do inpatient, we do outpatient. We have our own emergency department there. So we do a lot of different things. Then I also lead the residency and the medical students, as well as our fellowship for nurse practitioners.
That's a mouthful. We appreciate you doing all that for our community, no doubt. Let's talk a little bit about the obvious. We are now, I like to say, we're right at 11 months in this pandemic. I kind of use that March 13th as really the shutdown date for our community. Give me an overall 10,000-foot view of mental health and what you're seeing in our community now compared to a year ago.
Yeah, I mean, when you look at some of the numbers, they're a little bit all over the place. Certainly, when you look at, especially when we're looking at children's visits to the emergency room, which is kind of the indicator of acute crises, those are actually those have been trending down. Could be multiple reasons for that. A lot of it may due to the fact that with schools being out, a lot of the behavioral issues that we see associated with kids in schools are not there. But we are seeing more anxiety, depression, and that really is across the board, whether it's adults or children. Certainly, when you look at our own EAP numbers, which is our mental health to our own workforce, those numbers are actually up. So and certainly the other piece I can say is for individual visits, those are up. We're having less people not show up for those visits, which is good. It probably is, and that's probably due to a lot to the fact that we do a lot of telepsychiatry and telepsychotherapy now, as opposed to having people come in person. So it's a lot more convenient, which I think has been a real plus for people. But overall, I would say that it's mixed when I look at how we're doing overall.
Right. Let's talk about high school, middle school type students. We've got them back playing sports.
Yes.
There are some other activities they can do, but granted, that doesn't account for 100% of all high school and middle school students. There's a huge percentage of kids that really aren't involved in anything, or may only be involved at the church, and the church is not happening right now, or whatever. What role is isolation playing right now in our community as far as these kids are going that are not getting outside of the house, that are not communicating? Maybe they don't have a lot of close friends. What type of things are you seeing from these children?
Certainly, isolation and loneliness is a big risk factor for both the behavioral health illnesses, suicide attempts, drug and alcohol abuse across the board. And so while I can't say individually are we seeing more people, more kids coming in because of loneliness. I can speak for adults. I know that we're seeing more adults coming in and sometimes need to be hospitalized for loneliness for the exact same reasons. And certainly with the pandemic, we're seeing a lot more isolation. Globally, when we're looking at the pandemic, I know we're seeing more and more kids using video, whether it's telephones, whether it's video chats, etc., to reach out, stay in contact with other children. That's of course always a double-edged sword. It can be used appropriately to make sure that they're socializing with their friends and family. But there are times also when it can lead to bullying or any kind of inappropriate use. So it's really important that parents monitor that contact and monitor children's and adolescents' use of computers.
Right. Exactly. Let's talk. I was using myself just as an example before we came on the air, and I am sure I speak for a ton of adults. I don't know that I'm the same person that I was 11 months ago. I don't know that anyone is. I think just the fact of having so many things taken away, whether that's financially, emotionally, or just being able to go and do things as much, maybe we're we're a level below showing up at the hospital or showing up somewhere like that. But what are some things that we as adults need to be keeping an eye on and being able to work through this pandemic right now until we can get back to that kind of normal situation?
Yeah, and I think, and again, I think Trip, you're not alone with that. I think a lot of people would say that they've definitely changed over time. We're social beings. We're used to being around people. Even when example, I still go into work. Some people, a lot of people work from home now, but I still go into work. But even when I go into work, I can tell you that the amount of social interactions are much lower than they used to be. There's no chatting around the water cooler. None of these you're not having any meetings in person. So any meetings you've got are by video. And while that's a form of socialization, it's certainly not the same. And certainly we're not able to, at least a lot of people are if they are going out to dinner, they're doing it less often, less movies, less parties. And so that again, that kind of, that isolates people. And so certainly we're seeing a result of that. It's harder to, we use socialization to help decrease stress. And so people are more stressed out. And part of that is due to isolation. Part of it is due to financial issues that people may be having. Part of it is due to change in their lifestyle. And part of it due just to worrying about getting COVID. I know that certainly that can be a very scary thing in itself. As somebody that's been through, I've had COVID. Certainly, that alone was not a pleasant process. It was certainly not. It was certainly very difficult. I had a lot of shortness of breath, et cetera, associated with that. So there's a lot of different reasons right now that are increasing anxiety and stress on people as well as just being isolated.
Completely. I also was talking to you earlier about at some point we're going to get back to some form of normal when we can all go to a Panthers game or a Knights game, or we can get on the train and go downtown or things like that, back around people. I'm not so sure that's going to be as easy of a transition as many of us would like for it to be after being stuck in something for 12 to 18 months and then a new change in life. How will that adjustment go? Do you understand what I'm saying? That I'm just worried it won't be as easy as we would like for it to be.
Yeah, I think that's going to vary from person to person. I think some people will be able to jump right back into it. Some people, quite honestly, haven't modified their lifestyle a whole lot, even during COVID.
Very true.
I certainly, while I don't join a lot of these parties, I certainly still see parties on my street, et cetera. So some people haven't missed a beat, but there's a lot of people that you're right that have been more, have had to isolate more. And so that's certainly going to be a change. I mean, even kind of going back out and not having to worry about infection, that's going to be hard for some people where that's been a real stressor. All of a sudden being around people that are coughing on you, breathing on you, when before you never noticed it, now all of a sudden something that for a lot of people, they're going to still feel it's threatening. Even though hopefully when we have a vaccine, but hopefully when everybody's vaccinated, that threat won't at least be around as much. So yeah, I think we're going to see definitely a change. My guess is initially, while we think everybody's going to go out and run in the street and party, my guess is it's going to be a lot of people are going to be slow to get back to a lot of what we used to do back a year ago.
I agree completely. Talk a little bit about, without throwing you into the middle of this great big debate that's dominating our county right now, how important is it right now for kids to have the opportunity, the choice to go back inside of a classroom and be around others?
So I kind of frame it. And I think it's very important for children to be in school and be educated. And because I think public or private school, they certainly, they're a foundation of our society, and you can't replace the socialization for children that they get in school. And quite honestly, a lot of kids have a hard time learning video as well. And I think the other thing we're seeing, unfortunately, is the ones that are most at risk are the ones that are having the most difficult time. The students where school has always been easy, video probably isn't going to change that a whole lot, but certainly for the children where they've been more challenged by education, certainly learning and not having those same cues of having the teacher in the room, having the kids around them learning, that's going to be more difficult. Having said that, the piece that we also have to keep in mind is safety. And so that's the piece where I really can't speak to, and that is, are we able to socially distance as well? Are we able to have are we have all the ventilation that we need and all the different safety measures that they're calling for the schools to be safe? And so that's the piece where I kind of leave that up to the school board to make that decision. Certainly, when they decide that it's safe, I certainly would be totally in favor of the kids going back, but that's the piece that I just don't have the insight into to say, okay, do we have all the safety measures we need for the kids to go back? But I certainly hope it's as soon as possible, because I do think children are suffering right now.
No doubt. What's the best thing for a mom or dad to do if they just see things that worry them a little bit about their child? That not that it's the far-reaching suicide attempts or something like that, but something that just worries them. Is there a way for them to reach out, or where do they need to go to? It's not something that we as adults know who to call instantly.
Yeah, I mean, certainly the kind of the warning signs we look for with kids are, are they not wanting to engage in the activities they used to want to engage with? Irritability is a big one, because they can't always tell you what's wrong. So irritability, certainly changes in sleep, nightmares, changes in their eating habits, changing, if they look more fatigued. Those are all things to look for. And again, as a parent, first thing to do is making sure you've got open lines of communication with your children, being able to talk to them, and be able to ask them questions about how they're doing. Certainly, if you're ever concerned about safety, it is something we encourage people to ask, no matter what the age. The evidence has always shown that there's no increased risk. You're not going to make somebody suicidal or make somebody homicidal or whatever else by asking a question, but you certainly can save somebody's life by doing that and taking their response seriously. And certainly, if a child, sometimes it's very easy when kids say something to say, oh, they're just being dramatic, but certainly any kind of threat is something we should always take very seriously, because if you're wrong, and they're not suicidal and they're telling you suicidal, and you get out, and you go take them in and get them the help they need, and I mean, there's no foul with that. Obviously, though, that if they are suicidal and you don't take it seriously and something happens, that's life changing.
One thing I feel like I've noticed the last few years, it's becoming more okay to talk about mental issues. It's becoming more okay to share your feelings. Have you seen that over the last few years?
I will say I've seen on multiple different accounts. Certainly, with our increase in our own employee assistant program, the fact that we're seeing so many more people come forward, I think that's a piece of that, because certainly, believe it or not, the people that least often ask for help are healthcare providers. You think it'd be the opposite, but we're really bad about it. So the fact that we're coming forward really speaks to that. But I would say even the fact that I'm on this program right now with you speaks to that, because I know I've been on multiple different media outlets that I never dreamed would be talking about behavioral health and behavioral health topics that really have been more focusing on that over the last year with COVID. And I will say, if there's ever a silver lining to anything, and I certainly don't want to. Certainly, this pandemic is terrible, and I don't want to make fun of that. But I will say that the one thing we've seen that's good that's come out of it, I think, is it's better for people. It's easier now for people to talk about if they're depressed, if they're anxious, if they're lonely. If anything, COVID's given them an excuse now to talk about it when maybe they weren't willing or able to talk about it before. And it's also really shined a light now, so that people that, if you are depressed, or if you are anxious, or if you're having suicidal thoughts or whatever else, you can come forward and feel like people are going to support you and want to talk about it, where in the past, I think that just hasn't been the case, unfortunately.
Thank you. I completely agree with what you're saying. And I tell you, just on behalf of the community, thank you to you and your staff and all the folks in your profession right now. I know they're working overtime and seeing more people, but thank you so much for all that you're doing and all of your employees.
Thank you, Trip. And I know that I mean, our goal, and we're grateful for just the fact that people are now coming forward, and more people are getting the help that they need, because that's our biggest hope, is to be able to, if anything, make people's lives better. Because depression, anxiety, while it takes a toll, we always talk about the suicide, because that's kind of the people that die by suicide, because that's such a big event. But really, depression, anxiety takes a much greater toll on our society than just that. It's the lost work, it's the families that it affects, it's the kids that it affects. It has a far-reaching effect, and so the more people we can help, the better.
Oh, we're very lucky to have you here in Charlotte. So thank you for joining me. This has been Tripper Oaks with his very special guest, Dr. James Rachel from Atrium Psychiatric, and everything that he told us early on, all the good work that he does in the community with behavior. So thank you so much for joining us. I'll be back again tomorrow night. But until then, have a great evening and stay safe. Take care.